While the Affordable Care Act has increased access to health care for millions of uninsured Americans, the program is bleeding red ink and losing customers. The core of the problem is that the vast number of young millennials who were supposed to sign up for a low-cost silver plan didn't. If they were lucky enough to get a taxpayer subsidy, they might pay as little as $241 a year in premiums. Or, if they were earning somewhere around $24,000, they would pay premiums totaling $1,523. If they did neither, they would have to pay a penalty of $695. The math is pretty simple. Without a subsidy, a millennial would save $828 by paying the fine. Even if they did buy Obamacare insurance, they probably wouldn't be able to use it. The annual deductible for an individual with a silver plan averages $3,177. The fine is also negotiable. Last year, 12.5 million taxpayers were exempted from the mandate for a variety of reasons, including low income and experiencing various hardships such as bankruptcy. Meanwhile, consumers 55 and older who typically have the highest healthcare costs comprised more than a quarter of all enrollees, even though they make up just 16% of the eligible population. Lower enrollment, especially among young, healthy consumers, is one of the factors driving the increase in exchange premiums, which are rising 25% on average this year. Higher premiums will make it even more likely that healthy consumers will make the economic decision to choose the penalty over the insurance. About 10.4 million Americans were enrolled in exchanges in the first half of this year, less than half the number projected by the Congressional Budget Office after the Affordable Care Act was passed. That number might fall even more since some top insurers, including Aetna, United Healthcare, and Blue Cross Blue Shield, have pulled out of Obamacare exchanges in many markets.